All right, so that brings us to our featured guest speaker today, who is Eva Thibaudeau-Graczyk. Close enough. Coalition for the Coalition for the Homeless, Director of Programs. You know what, let me start over. Let me start over for the camera here. Is that right though, Graczyk?
Graczyk. Yeah.
Graczyk? Okay, very cool. All right, starting over. All right, so yeah, that brings us to our featured guest speaker here today, who is Eva Thibaudeau-Graczyk, who is the Director of Programs for Coalition for the Homeless. Before joining Coalition for the Homeless, Eva was honored by the Coalition in 2013 with a Friends of the Homeless Award as the Sally Shipman Service Provider staff recipient. Eva joined the Coalition's management team in August of 2013 as Director of Programs. And as the former project manager at Search Homeless Services, Inc., Eva led many successful efforts to provide safe housing and needed services for homeless individuals. A community services advocate with 15 years of field experience, she obtained her master's in social work from the University of Houston. So please welcome our guest speaker today.
Thank you.
And yeah, just mouse through the slides.
Just click this. All right. Well, thank you. I'm really excited to be here. I was not being rude and texting people on my phone while the previous people were talking and presenting. I was writing down all the things that I'm going to look up and make reservations for when I get home. So, thank you. As Vic said, I've been working in homeless services for over 15 years. Before that, I worked in foster care and adoption. And I was working with children who oftentimes were placed in foster care because of their parents' homelessness. Although we're not supposed to remove children because of poverty, we do. And so one of my big revelations when I moved from working with children and into adult homeless services, I was working with a gentleman and we were trying to get him housed, and he looked very, very familiar, and I was trying to figure out why. And probably the third week of our working together, I realized that I had been his children's foster parent. And they had had a pretty wretched experience, quite honestly, in their birth home, and they were removed for very good reasons. And yet I felt this compassion and this agape love for their father, who I was helping to house. Because as a good Unitarian Universalist and a former Catholic who's still recovering from the guilt, I believe in deeds, not creeds, and I'm really happy to be here today. So thank you. When the call came through for who can talk to the Humanists of Houston and the Atheists Helping the Homeless, I was like, me. I'll go. It's a Saturday. I don't care. I'm super excited. Let me go share. I want to talk with these folks. So I want to give you kind of our presentation that we've been taking around about how we've really changed how we're addressing homelessness in Houston. I've been in this work, what I call pre-system change and post-system change. And pre-system change, we were all a bunch of people who were very, very siloed and were very committed to the work that we were doing. But we weren't having a huge impact on ending homelessness or changing the path out of homelessness for people because we were working individually, not collectively. And so in 2009, Barack Obama signed into legislation something called the HEARTH Act, H-E-A-R-T-H Act. And it was the first update to congressional legislation around homelessness and the funding of it and what it would fund in about 25 years. So it really, really changed the playing field. In 2011, the federal regs came out that told homeless service providers who were getting any kind of federal money, this is how you must act. And so when the McKinney-Vento Act, which is the big legislation that started homeless services and started federal payment for it, when that was authorized, homelessness, modern homelessness anyways, street homelessness, family homelessness, it was relatively new. So people didn't really know what worked. there wasn't a body of evidence. Well, 25, 26 years later, when the Hearth Act came along, there's body of evidence. And so in a nutshell, what the new legislation says is that you need to be using best practices, not what your gut tells you feels good or is the right thing to do. So these are things that are based on science, which is, I'm sure, appreciated in this room. So as a community of homeless service providers, of governmental entities, of private funders, we have come together and we have called ourselves the Way Home. Because we realize that when we move from doing things as individuals and doing things as a system, it's hard to find the language to talk about the work that you're doing. It used to be, I'm Eva and I work for Search Homeless Services and we housed 5 people this month. When you're working as part of a system and you have 15 different agencies all taking part in housing 500 people, it's hard to tell that story. So we're in Harris County and Fort Bend County, we're part of what's called a continuum of care. It's a federal jurisdiction that has been given to us, and we have a really sexy name, TX/700. So we decided that probably wasn't like, really jazz people up. So, yeah, man, TX700, we're changing the world. And so we came up with the Way Home. So we adopted the federal plan for ending homelessness. And I say that because at the beginning, I think our federal government, led by the Obama administration, was very optimistic and very kind of hard-lined. And they said, we're gonna end homelessness. Well, I used to work for a military guy who got into homeless services, and he would say, Eva, go find that lady who we got that call about and get her into housing. I'm like, well, buddy, because that was his name. Buddy, that's a person. And she's not a bag of sand. And this isn't a military operation, and I can't throw her in my car and go deposit her in permanent housing, okay? So I will go out and I will engage, and I will talk about options, and I'll go back and I'll do it again and again and again until we find the right moment and the right time and the right fit when she trusts us enough to accept housing. So I will say the federal government has evolved, and they have realized that what the call to do is to transform systems so that there's a better pathway out of homelessness for all people, regardless of what they're experiencing. So we took on the charge to end chronic homelessness by 2015. Chronic homelessness is essentially the people who've been homeless for a year or longer, living on the streets, serious disabling conditions. Typically in homelessness, that's going to be serious mental illness or substance use. With a whole host of physical issues that go along with that. But in our world, unlike the Social Security world, we recognize that substance abuse is a disabling condition. It is a medical and behavioral condition. It's treatable, but that qualifies you essentially as being disabled in our world. We took on the charge to end veteran homelessness, end family homelessness, and also end youth and young adult homelessness. So we came together as a community in 2011 with a whole bunch of what I call HUD love, but it was a bunch of technical assistance where experts from all over the country descended upon Houston and worked with us to radically transform the way that we were doing things. So in the Stone Age, a homeless household would try to get services, and if I showed up at Career and Recovery Services, they might say, our expertise is employment and substance abuse services, treatment. And so you're gonna get employment services and substance abuse treatment services because that's what I have. But if I went to Catholic Charities, let's say, where they have permanent supportive housing, they may have said, we have permanent supportive housing. You need permanent supportive housing. It was not very household or client focused. If I went to a case manager who had been in the field for 20 years, like I was, I had everyone on speed dial. People knew my name. They would answer the phone when I called. I could get you housed. If you're just out of school and you have all the great intentions, you want to make, you know, everything better for people who are experiencing homelessness, and so you get the directory and you start calling and leaving messages at the main number, no one's going to answer your call, and it's the family or the homeless person in front of you who suffers. So we put homeless families on this crazy journey of having to run all over, try to beg for services all over, try to figure out what story do I have to tell you to get something, not you looking at me, the homeless person, and saying, what do you need? And we will find that within our system for you. Layer on there that there are all sorts of public funders, there are different service packages, there are 80 plus providers, all sorts of target populations. Our funders used to say, we're going to prioritize single mothers with half a toe missing and 3.4 children. And another one would say, well, we want to do veterans who are recently released who have one child who's in CPS custody. And so we had all of these crazy restrictions that kept us from being able to do the right thing for people who are experiencing the crisis and trauma of homelessness. So we went away from being program and funder centered to being system and client centered. We took all of the housing that's available, and we put it all into kind of one big pot. This is called coordinated entry. And so everybody now in the Houston-Harris County area who has homeless housing, they no longer are going out and looking for who's a good fit for their program. Instead, homeless individuals experiencing homelessness in our community are assessed by a coordinated entry assessor. And we use a homeless management information system. It's an electronic database. Everyone gets asked the same questions. There's like triaging logic behind the questions, and everybody kind of gets spit out into two chutes of housing. So there's something that we call rapid rehousing, which is short-term rental assistance, maybe up to 24 months, and then supportive services. So, for example, all of our homeless families right now in our, and this is literally homeless, so I'm talking shelter homeless, okay? But all of our literally homeless families right now in Houston, Harris County, Fort Bend County have been assessed and have been assigned a case manager for the intervention of rapid rehousing. So that means that somebody helps them find an apartment, helps negotiate with a landlord, pay a deposit, help get utilities turned on, start paying rent, and then work on budgeting, getting your kids back in school, so on and so forth. And then eventually, as you no longer need our services, we go away and you stay in your apartment where you've signed your lease. So that's one housing chute that you can go down. The other one is permanent supportive housing. So if you've been homeless for a long time, you have significant disabling conditions, then permanent supportive housing is probably going to be the best intervention for you. And what that is essentially a lifetime subsidized housing. Think of it like Section 8, except it's not necessarily. And so it's lifetime subsidized housing with supportive services available. And so there might be a nurse practitioner, maybe a psych tech, an intensive case manager, a peer specialist, who are all part of your health and wellness team. The other thing that we adopted as a community, I was explaining to some people before this, is a philosophy called housing first. And so we used to, back when we thought that our really big brains and our guts, that told us, how to help people exit homelessness, we thought, first of all, we'll start soup kitchens. We'll feed people. Wait, we'll open a clothing closet because, they're not getting out of homelessness because we're feeding them. So we'll give them clothes, and then maybe that'll get them out of homelessness. And then we thought, well, that's not quite doing it. So I know, I'll build a place for them to stay, and then I'll give them life skills, and we'll do sobriety classes, and I'll give them a curfew, and I'll put them on a budget, and I'll make them save money, and I'll give them parenting classes, and maybe we'll do some art therapy even. Mm-hmm. And then in like a year or two, they're going to be self-sufficient, and then they can go away and get their own place, and the next person can come in. Well, we were spending inordinate amounts of money on these very high-touch, 1 or 2 year programs that were bricks and mortar, and we still weren't seeing any kind of reduction in homelessness. And so someone had this awesome idea, and they said, wow, what if the way to end homelessness was to give someone housing? Yes. So some radical folks on both of the coasts, they adopted this idea of housing first. So they took the most difficult, lowest functioning, most vulnerable, directly off the streets, and said, let's move you into an apartment. And you don't have to engage in any services if you don't want to. We're gonna keep asking you, but you don't have to take a UA, you don't have to go to drug treatment, you don't have to do any of those things. You don't have to get on psych meds. You just have to, not break your lease. So when we work together, we'll work on how do you be a good tenant. Do what my neighbor does and drink in your own home. Close the door and don't bug the neighbors, but I don't care how much you drink, okay? Do what the people, the artists a few houses, away from you do is, keep the pot inside, okay? And don't go out driving, These are the ways that you're a good neighbor. And it's what people all over America do without life skills and budgeting and going shopping with a case manager and all those sorts of things. And so, I'll get back to housing first, but I wanted to say, so those are two of the big game changers. Is number one, doing this coordinated entry and then saying, we're about housing first. So we're not about putting up barriers to housing, we're about getting you into housing regardless of what's going on, because we recognize that that's a powerful intervention. It's healing in and of itself. So we also, as a community, had to come up with a new way of being accountable. We used to all be individually held accountable to our funders, or to our boards, or to our, the people who donated to us. What we did as a community was come together and we put together a governance structure. We have what's called a Continuum of Care Steering Committee, or the Way Home Steering Committee. It's made up of the heads of the Harris County Housing Authority, the Houston Housing Authority, the directors of the Community and Economic and Housing Development Departments of both the cities and the counties. There are private funders represented on it. There are providers represented. There are consumers with lived experience who are also part of it. So they oversee all the policies and procedures and funding decisions of what's happening in our community. Just want to make sure you're seeing what I'm saying. And so then we had to look at, there's a lot of work that needs to be done. So we've broken it up into different areas. We have various work groups that people are welcome to be part of. Those work groups kind of do the day-to-day work and give recommendations that then go back to the steering committee adopts, and then the coalition was asked by the community to act as the lead agency. So we do the work, the day-to-day work. When everybody comes together and they have their ideas and they say this is what we should do, well, they have to go back to their job. Somebody has to actually see that through and make that happen. And so that's what we do at the Coalition for the Homeless. We're the project managers for the system. And so that's where I'm saying that's supported by, it's the project management team, which is largely the coalition, and my team. So we've been kind of busy. We have this intensive project management going on. And then in each of these areas that's in the circles around here is a whole body of work. So for example, downtown transition planning. When we looked at what it took to get your daily needs met if you're homeless, we mapped it out. So let's say that you're staying at Salvation Army Men's Center up on North Main, and you want to get breakfast. You have to make it to Palmer Way Station, which is all the way at the end of Herman Park. And then to get lunch, you need to get from the end of Herman Park to maybe Search Homeless Services, which is in Midtown, or the Beacon, which is in downtown. And then you have to get back in line to get a shelter bed by 2 o'clock in the afternoon, so you have to hoof it back up. So, I mean, and then, heaven forbid, you have to go to an appointment at the VA, because you're a veteran, you have a medical appointment, or you have to get a birth certificate or something from the Bureau of Vital Statistics. Those are both off at the end of the medical center. So forget lunch, forget breakfast, you're gonna spend all day trying to get there and back. If you have to go to the Social Security office, well, then you're off over by Reliant Energy. So we started looking at what it took just to get the basic things done on a day-to-day basis, and we had people going within a 40 square mile area trying to get basic needs met. So we invested some money that came through the state in capital campaigns. So Search Homeless Services, for example, moved their building to be closer to the Beacon and to be closer to Star of Hope, their men's development center. Healthcare for the Homeless moved into that downtown area. We worked together as a group, and Palmer Way Station decided that they weren't being helpful serving out of their church anymore. And they made the decision to stop serving breakfast at their location, and their volunteer group moved to take over aspects of breakfast at the Beacon, so that the Beacon now could serve breakfast and lunch by using them. Same thing with Communities of the Streets, which is another Episcopal group that's over by HCC Central. They moved out of their building and became part of what was going on at the Beacon. So we started trying to co-locate services and shrink the footprint of what a person who's homeless has to do. One of our issues, so that was a downtown redesign. One of our issues is that our emergency shelters here, number one, are all private and faith-based. They do not, for the most part, accept any public dollars. So that really has decreased our ability to have any kind of influence on their operations or what they're doing. So we've had to do a lot of trust building, a lot of kind of waltzing together and, seeing, what can we make work, what isn't working. So we did some kind of radical redesign at the Beacon, which is a huge day shelter, and they serve meals for those of you who aren't familiar with it, and they have other services in there, including a homeless health clinic and psych services. But we asked the Beacon to restrict their services to chronically homeless, very vulnerable, high-need people, because it's a very, very low barrier, low demand environment. And anyone who did not fit in that category, we asked them to, I'm going to use the word push, but not literally push, but to suggest to people that they seek services and that they seek coordinated entry through one of the shelters. And so the shelters now have allowed our coordinated entry staff to co-locate in their shelters. So when you come into a shelter, you're immediately assessed for housing. The other piece that we've now moved into shelters is what we're calling Income Now. For those of us social workers who were on the social services side of things of homelessness, we were really jazzed and like, oh yeah, we're gonna end homelessness with housing, and this is so cool. But then we're like, a few years later, we're like, oh, but to actually stay housed, people might need income. Yeah, so all of our employment people were like, well, no kidding, folks. So we started last August an initiative called Income Now. So we now have workforce solutions hubs in every emergency shelter within our area. So we recognize that we can work with chronics and veterans and youth and young adults and families, but the vast majority of people who are homeless are not chronically homeless. They're not veterans, they're not in a family, and they're not a youth or young adult. There's likely never to be enough money to be able to offer housing assistance to all of those people. And so what do we need to do? We need to make mainstream employment services work for them. And so we got together with Workforce Solutions, the director of the HGAC and Workforce Solutions is on our steering committee now. And they've put these hubs in. So for a lot of people who get assessed through coordinated entry, rapid rehousing, a light touch might be their answer, but they're not likely to ever move up on the waiting list because there'll be a family who's ahead of them. And so they're also assessed for what their income way out is, and they start working on getting connected with income mainstream employment today. There are other options. For example, if you are likely to be a good candidate for permanent supportive housing, then we look at, are you eligible for disability? Do you have disability benefits? You know, how can we increase that? So that's kind of what's going on in our emergency shelters and coordinated entry. Yes?
May I ask a question now?
Please, please,
Sure,
please.
Okay, yeah. The halfway house, substance abuse halfway house model. Louder?
Yeah.
Speak up. Oh, the substance abuse halfway house. For the higher functioning homeless, are they eligible to use the halfway house system because that's such a good recovery model?
So kind of two minds on that. You know, in many ways, so some of the recovery centers who have housing attached to it, they do have what they call indigent beds. So for folks who are uninsured, so like Cheyenne Center, the Right Step, you know, places like that. Then there are a lot of former substance users who have sometimes incorporated into a 501c3, sometimes not, or you know, a nonprofit, and you know, rent a house or start a program, and those we don't refer to necessarily. You know, we recognize that it works for a lot of people. When we look at funding within our homeless service community, we say we will fund and support something that is evidence-based. So like you're using motivational interviewing, which is a best practice, that you're using peer recovery specialists, which is a best practice, and that, you know, you're offering choice of, you know, recovery modalities. So SMART is a non-religious recovery modality, as opposed to like 12 steps, for example. So more of our kind of halfway houses, now there are halfway houses that if you come out of recovery, you can pay to be in. They're really not working with our folks that much. And the ones who are typically working with our folks, they tend to be very, very religious based. And so we just try to let that be client choice, if that answers. Are there other questions at this point?
Where does your major funding come from? Do you try to sign these people up for disability benefits from the federal government, things like that?
Yes, we absolutely try to get everyone connected with mainstream benefits. There is a researcher out of Pennsylvania named Dennis Culhane, and he did some really fascinating research and made some recommendations pre-HARF Act. And one of the things that he looked at was, where is housing and urban development dollars going when there's, so that's the huge funding source for homeless services, is it all comes through HUD, Department of Housing and Urban Development. And so he looked and he said, wow, there are all of these homeless housing dollars that are being used for services. So they're being used for things like opening and operating employment service centers. They're being used for subsidizing food for people. And then he looked at, you know, we have all of these mainstream services that are funded and that are supposed to be for everyone. For example, our workforce investment boards, which here is our workforce solutions, they're funded out of the Department of Labor to help people find jobs. So why are HUD dollars being used to create these shadow parallel systems to serve people who are homeless? So philosophically, it's been an interesting time because HUD really tightened up and said, we're not funding what other people should be funding. Other places in the federal government need to get better at serving this population because they are charged by mandate to you know, give these mainstream benefits. So there's something called the U.S. Interagency Council on Homelessness, and it has all of the cabinet secretaries there, and they're really working on how can Department of Labor pay for employment services for people who are experiencing homelessness. And so there have been some very specific, grants and opportunities to do that. In fact, the reason that we got the Director of Workforce Solutions to be on our steering committee is because the Secretary of Labor called him and said, "You're gonna get a call from Eva, and I suggest that you say yes to what she asks." Which is kind of cool. But the same thing I would say with, so right now, the Secretary of Health and Human Services she's the chair of the U.S. Interagency Council on Homelessness. And so we're seeing some really interesting opportunities coming through Health and Human Services around youth and young adult homelessness and trying to prevent that, because that's really outside the realm of addressing the crisis of homelessness. Once someone's literally become homeless, that's what HUD's charge is. Health and Human Services charge should be if you are working with a family and they're experiencing abuse, neglect, instability, and CPS is involved, or if you've had to remove a child from their family's custody and put them into other custody, you have a greater responsibility not to just take your services away and then this family, becomes unstable or moves eventually into homelessness. Same thing with the Department of Justice. A lot of times, and we have a lot of folks here who are in Houston, the greater Houston area, who are really working diligently around with our reentry populations. And they keep coming to homeless service agencies and saying, this is your problem. And we're like, it really kind of isn't. It's a Department of Justice problem, and there need to be some dollars if we're going to incarcerate people and label them with felonies for non-violent, drug things and low-level drug offenses, and we're going to take, their core learning and networking and career building and education building years away from them because we've locked them up and institutionalized them. You also have a duty to do something to reintegrate them. And so those are the types of things that we're doing at state and federal levels, is trying to get everybody to own their own piece. So that's the long and I think more interesting answer too. Yes, we try to connect people with mainstream benefits.
The funding to reduce the mental health population in the jails, is that part of this initiative to
Yes.
I would hope so.
We work formerly known as, the agency formerly known as MHMRA, for those of you who don't know, because we don't use the R word anymore. It's now intellectual disability. And so they are now the Harris Center for Intellectual and Developmental Disabilities and Mental Illness. So they're the Harris Center, but we work very, very closely with the Harris Center, particularly in the jail. So we're constantly doing data matches with jail data and looking at, who are what we call frequent flyers, and how can we connect with those people while they're incarcerated, and instead of having them released at 12:01, so like 1 minute after midnight on the day that you're due to be released, because it's your right. I mean, you have the right to be released on the first minute of the first day that your sentence is up. But we're getting people released at midnight downtown, especially if they're in for, drugs or substance use or something. What do you think is going to happen? There's nowhere to go at that time. So we work with people to ask to voluntarily stay until 9 a.m. the next day, and then we can have a case manager meet them at the doors of the jail and work on the housing piece and get their psych meds and all of that. So we're doing a lot with Jail Inreach. You had a question, and then you.
Housing services at cost. Are you running in the black or are you running in the red? Is there enough money to actually meet these costs?
So yes, yeah. So essentially the issue is that housing and services, they cost money. And so, how do you find the money to do this? Are we in the black or are we in the red? So what we did in Houston, which is in the greater Houston area, and sorry, Fort Benders, I include Fort Bend in that. What we did is look at where we were spending money now, and we made some really, really difficult decisions, and we moved where we spend money. So for example, there was a really old program that had been serving people who had been homeless, who had a disabling condition. They'd been serving them for probably 15 years, and there were maybe 200 people in that program. And it just, I mean, people have been housed for so long that they were still poor, but most of them were doing pretty well and didn't really need intensive services. So we decided that that wasn't a good use of our community's dollars. And so we worked with the Houston Housing Authority, and we transitioned 225 people onto housing choice vouchers, formerly known as Section 8. So they could stay in the apartment that they've been in. They just switched subsidy types. So now they have a housing choice voucher. We freed up those supportive services dollars, and we took that $3 million and applied for rapid rehousing for families.
The question still stands. You've got costs. Do you have enough money to meet the costs?
At this point, we do have enough money. Both of the housing authorities have ponied up, where we're able to match. Both of them have done what's called a homeless preference. So if somebody is homeless, they actually jump the wait list, given certain criteria. They also did a youth and young adult preference. So we're doing some interesting, innovative things. So having over $30 million in housing and urban development dollars, that's primarily for housing. And then an additional probably $6 million in what's called Emergency Solutions Grant. It's another HUD funding stream. And then aligning those two with housing vouchers, we're able to meet the demand. As of last week, we were down to 9 literally homeless families on the waiting list for housing assistance. So
Service.
And services, yes, and so services are also funded through a lot of these same dollars.
And the same answer applies, that is basically, here's your cost, and...
Yes, there's a cost for both, and I would say kind of the biggest thing, so we've also had a lot of investment from our philanthropic community, is that, you know, the cost savings to house someone and give them supportive services as opposed to leaving them on the streets and cycling through, you know, jails and warrants and emergency rooms and all of that. The cost savings is so dramatic, and their match to public dollars, I mean, you know, it's like for every $1, we're able to match 10 public dollars, which has been a nice argument for people who are investing in the system. So, and then
Staying with the money thing, and I usually deal with this in the context of access to health care. The conservative self-righteous in our midst would always ask you, how much is it going to cost? Now, I think that this came to me recently. We are dealing with a ledger book. There are two sides. There's debits and there's credits. And the proper question to be asked, if somebody asks, is what do we get for how much it's going to cost? We're going to see less of these people on the street, less crime. We're going to have people who are not as sick so they don't, you know, wind up misusing health care for things, et cetera, et cetera, et cetera. Yeah, it's gonna cost some money, but the return is more than we put in.
Sure, so we talk a lot about the cost savings. It's estimated that leaving homelessness untreated in our community is costing us over $100 million annually. And so, and that's largely taxpayer dollars because we're not a Medicaid expansion state. And so poor people don't get health benefits unless they get them through the Harris County Hospital District, which of course comes out of our pockets. You know, we pay for the EMS, we pay for, you know, the the police intervention, we pay for the jail, for the booking, you know, all of these things, for the emergency psych. You know, all of this is coming out of our pockets. And so you're gonna pay it to do nothing, or you're gonna pay it to do something. You had something?
It's a pretty complicated structure you have up here.
I
I've got
know.
to think there are an awful lot of professional people dedicated to making that work. And so, apart from the question, the point that Ariel made, has someone put these metrics together? How much does it cost to actually transition an average homeless family from a homeless state to a well-positioned state outside of homelessness? And you mentioned before that you only had a few families on the waiting list, but what about people who aren't families, and what proportion of the homeless are they compared to the families?
Sure, so again, a question about costs, and then also,
And those would be all-in costs, including
sure.
all the professionals.
Sure. So I will say, I mean, this is an all-in cost, not just like what gets spent on the family or the case manager, but, you know, I'm assuming you're talking about the work that we do at the Coalition as the lead agency. You know, I have 4 project managers, and, you know, that we spend all of our time working on these issues. Now, as far as being able to give you an exact cost of what it takes, I can't give you that right now. HUD is looking at those things. They're making significant investments into communities like Houston. We're what they call a priority community, and that's why they started giving us all of this technical assistance quite a while ago. I was pretty impressed with HUD. For a federal entity, they really came together and said, you know, the directive from the Obama administration is really serious. They're saying, figure out how to end this, figure out how to prevent it. And everything that we've been doing, except for in little pockets, has not been working. And so Houston has really been part of 9 communities across the nation that are test sites. And you know, the feds are learning from what we're doing. We're learning and adjusting every day. And so at the end of the day, you know, a lot of what we learn, we now see it in regs and policies that are coming out of HUD. It's a really unique and interesting time to be part of homeless services. At the end of the day, what they'll do is they'll tabulate, I would say, what our decrease is in homelessness, and how much did they actually spend on us to help us get there, and then start looking at, you know, is it worth it? And are we going to continue doing this? From what I hear from my friends at the federal level, that they are, you know, starting to evaluate some of those things. Like when we give all of this technical assistance, and, you know, bring brain trusts in and, you know, help to support the work of communities, are we getting a return on our investment or not? In Houston, they are. And then
Wait, I'm sorry. Before you answer any more questions, have you finished your presentation? Because Yes, thank you.
Okay, no, that's fine. We can, if people want to keep going. I just have a couple more slides. And so, and I will come back to this one, because this really, you know, this really names the bulk of the work that we're doing, and I'm happy to answer questions about how we're working with specific populations. I want to talk a little bit about the numbers of street homelessness and sheltered homeless. So we do, we're in charge of conducting what's called a point-in-time count. And so Congress mandates that every community across the nation on a night in January, it's during the last 2 weeks of January, somehow does a homeless count. So it's pretty easy to get the number of people who are sheltered. You know, we get the numbers from emergency shelters. We have the demographics, we have the breakdown. How many were veterans? How many are, you know, women with children? How many are in, you know, 2-parent families? How many are fathers with children? So on and so forth. It's harder to do the street count. And so from 2011 to 2015, we used the same methodology, which is where we had about 700 community volunteers who would show up on a night in January, and they would break into teams, get in a car, and literally do an observational count. They would go up and down the streets, they would have a map and a grid, and they would look, and if someone appeared to be homeless, then they would make a check mark. And so Do you have the potential of having an overcount? Yes, because you might be capturing people who are going to go stay in a bunkhouse or stay at the motel down the street or something like that, and weren't truly homeless on that night. But we use the same methodology every year, so we figured we have at least the same room for error every year. So from 2011, you can see our total count was about 8,500 point in time, so one night in time. And 2015, we were down to 4,600. One of the reasons that HUD wanted us to be a priority community and gave us all this love is because our street count was higher than our shelter count. And so there was a real push to reverse that, is to move people off of the streets and to help the shelters become places where people felt okay or better going. And so we have had a number of things since really 2012, huge pushes of canvassing, connecting, identifying the most vulnerable in our street population, to the point where we pretty much said to everyone else, it's like, we understand that there are people in shelter who are homeless. We understand that there's a need, but until we get the sickest people off of our streets, we're not putting resources anywhere else. And so we focused solely on this chronically homeless population. And like I said, to date, we're at, I said this to someone else, I didn't say it to the group, but to date, we have housed over 3,700 chronically homeless individuals since 2012. It's been an incredible effort. That doesn't mean that we don't have a long way to go, and I'll come back to that. But this year, for our point in time count in January, we realized through some pilot efforts throughout this last year that we could do an actual count. So we had, over 3 days in January, we had 50 plus teams go out and get out of their cars and talk to every single person who they saw standing outside. And we had our surveys loaded onto tablets, and so they were doing real-time surveys with people. So we weren't guessing that maybe you're a Hispanic male, in your 40s, and you look like you're homeless. We were actually asking people. And so I can't give out the numbers yet because they're not final. But we saw, again, another consistent drop in the street population. It's more dramatic, but I really think that probably half of the drop is because of inflated counts in the past. So the numbers for this year will look a little bit different. And our sheltered population is down slightly, but it's pretty consistent, which would make sense if, we haven't started emptying the shelters yet. We're trying. So I'm gonna leave it on this slide unless someone wants us to go back, but there is a wealth of information about past enumerations, point in times, who's working on what work groups, it's all on this website, thewayhome.org or thewayhomehouston.org. And you can email info@thewayhomehouston.org, and someone in our office will get it routed to the right person. So is there anyone who hasn't asked a question who has a question?
Well, about this specific slide, it looks to me like there's a surplus of empty beds. Is there a reason why all of the numbers are reducing, yes, but you had so many sheltered homeless in 2011, but we've reduced that, but however, why isn't the surplus beds filled? Do we have closed shelters? Do we have?
So we worked with, so the question is, what happened? Did the shelter bed numbers go down? Do we have empty beds? We don't have very many empty beds. What we've done is what we call right-sizing the system. So we looked at a lot of temporary or transitional beds, those short-term ones where you could stay for like a year or 2 years, get really intensive program services, and then probably just when you were doing really, really well, we'd say, okay, now move out. And I say that having run a transitional housing shelter that I was trying to change into permanent housing. And so So what we did was we looked at people who were doing transitional housing and said, you know, would you consider becoming permanent? And so we did a whole lot of that, and that's where you see this reduction in these shelter beds. And then some shelters, you know, we said, you know, you're not really operating like a shelter. You're not really homeless housing if you're charging people.
Oh.
I can't tell you the calls that I get on a frequent, regular basis. I have a house. I want to help homeless people, and it'll be $600 a month. Well, that's, you know, so go on Craigslist. I don't know what to tell you, but that's not helping homeless people. So we did a lot of right sizing.
I had specific questions about our atheists helping the homeless. And I was wondering if you could address some of those. Are you familiar with what we do?
Sure. So the question is specifically about atheists helping the homeless and the interventions that are being used, you know, by that group. And the intervention, let me make sure that I'm addressing this correctly, is doing a regularly scheduled kind of distribution of things to people who are on the streets. Is that correct?
Yeah.
Okay. So that's a little dicey. So one of the things, so we very much encourage potentially using, you know, socks or a hygiene kit or, you know, a bottle of water as a way to engage and to create a deeper connection with someone who's on the streets. Because the idea is that when you think about housing first, is that, you know, people who are on the streets can get housing. And we need to talk to them about the fact that there are non-judgmental housing opportunities available to them. And so we have street outreach teams that operate full-time, and they're out and they take kids like that. And they, you know, have community volunteers go with them. And they use that as a way to really engage in a deeper talk about what the reality of housing is in our system, and that maybe when you tried last time, you know, 8 years ago, and we're told that you had to, you know, have a UA and blow a breathalyzer to get in the front door, and, you know, all this stuff. It's not like that anymore. And so in that way, it's very, very helpful. You know, I'll just bring up the feeding ordinance, which is not a feeding ban, okay? It's a feeding ordinance. And we very much support it, and I'll tell you why. People love to feed, and I love to eat, but when somebody gives me food, I want to make sure that it was made in a sanitary place and that it was kept at the proper temperature, and that it was stored correctly, and that, you know, like germs and bacteria aren't being passed along in it. And then the other piece is that as a citizen of this community, like when I have people over to my house and I feed them, I have garbage receptacles and I take it to trash cans. I also have bathroom facilities so that if they need to relieve themselves after they eat, which if you don't have good nutrition and your meals are not consistently timed, you have digestive reactions when you eat, particularly if you're eating unfamiliar foods or high fatty foods or high fiber foods. And so, you know, the city provides in designated places, they do a food safety training class, and then they help to schedule so that people aren't, like, you know, feeding in, you know, across the street from each other on the same day. And they've even connected groups, like someone we have a commercial kitchen. Oh, well, we don't, but, you know, could we use that and go out with you? So that's happened. And then the other thing is that they can make sure that there are bathrooms, you know, at the place, and that city sanitation can, you know, come in and clean up. So that's the deal with the food ordinance. And, you know, no one's been thrown in jail for feeding people and not going through the class.
Yeah.
But
Yeah.
they're not gonna be.
Well, regarding the feeding ordinance, I guess I should preface by saying a couple of our members, Randall Callanan and Jay Hamburger, are you familiar with, you may have heard of either of them. They've been very active in campaigning against the ordinance on television, in media, at City Hall, through online petition, which is like over 70,000 signatures that Randall put together. Anyway, well, my question, with regard to sanitation, I agree that's a legitimate concern, but it seems very strange to me that the ordinance even covers things like bottled water and prepackaged snack bars and things like that, non-perishable items as well, where there's no sanitation issue.
Unlike other feeding ordinances in other cities in the country, like St. Petersburg, Florida, and so on, it's the most restrictive in that regard.
So essentially the comments are about how restrictive the feeding ordinance is. And I wasn't part of writing it. I keep bottled water in my car and I give it out, okay? Don't tell anyone. This isn't going on in the World Wide Web, is it? No, I'm kidding.
Actually, it is.
I know. I'm a risk taker, okay? But no, we certainly, I go to a Unitarian Universalist church and, we do meal packs for the homeless. I personally would rather that people handed out bottled water and, a tin of meat than giving money.
Yeah.
I think, and I just want to real quickly comment on giving money. We're really at a place in our system where we're trying to move people into engagement and into accepting housing options. And we're trying to move away from helping people to stay on the streets. So we are intentionally trying to create some pressure points to help people move towards places where they can get what they need, not stay where they are. Which is why we typically say, don't give tents and sleeping bags. We can house people.
Well, just one thing real quick to follow up on that. You did mention that nobody's been jailed for feeding, right? For violating the ordinance. But,
Correct.
How many types of?
I think it's worth mentioning that, I think it's worth mentioning that you can be jailed. I mean, that's part of the ordinance, right? That you can be subject to be jailed just for violating the feeding. But apparently, from what I understand, the city of Houston is essentially, they're afraid to do that, obviously. They don't want to. Or they've never even fined anybody, from what I understand.
Right.
Because they're too afraid to do that because of the public backlash.
I don't even know if they're afraid to do it because of public backlash. I think it quite honestly is probably more of a response to business owners in the communities, particularly downtown and midtown, where that's where a lot of the feeding is. And I've certainly been part of things in the past where you pull up with a van and you've got a bunch of stuff and you've created a mini mob. I'm a shameless, liberal, crazy social worker from the Midwest who ended up in Houston, okay? But even I have to say, I do understand and recognize that there are business interests, and if it's your home or if it's your business, I don't necessarily want someone pulling up in front of my place and opening the doors and creating a mini mob and then leaving a lot of trash behind. It goes both ways. So I really think I know, and I say this knowing Anise from way before she was Mayor Parker. She's just very pragmatic. She's very matter of fact. She's very much a CPA. And, she was trying to support something that protected many interests, including the desire and the want for people to really do good things, to help their neighbors who are not doing as well as they are. So.
Of all the homeless on Houston, say about less than 5,000, what percentage of them had homes and lost their homes through economic reasons and salaries
lost their jobs, you know, and really want to be back in homes. And what compared to what percent are psychotic or drug addicted, and also another question, how long are the waiting lists that you have now? And I know this is an observation, I've read it in the paper and I've heard in a meeting, that protests by communities against apartments that are being built there for homeless people. There are a lot of homeless people in their neighborhood.
Yeah, so a few excellent questions there. You know, one, kind of, and I'm going to say it's, the question was about percentages of people who became homeless because economics, they evicted and you know, all of that. As compared to how many people have psychiatric issues or other things going on. And then kind of some of this, what's the the wait time for people to get housing, and what about the affordable housing, which is really what it's about, multifamily affordable housing backlash in our community. So most of the people, the vast majority of the people that you're gonna see on the streets, they're there because of serious mental illness or substance use disorder. You know, if I became homeless tomorrow, I wouldn't be under a bridge with my kids. You know, I have family I could go stay with. I have people who would help me out. It would take a long time of bridge burning before we checked into a shelter. And so, or, you know, we're under a bridge. And so, you know, there are typically some pretty significant things going on when people have moved to the streets and are staying on the streets. Oftentimes, our best time or our best occasion to intervene and engage and try to connect someone with housing is when there's a medical crisis. Which is why we continue to re-engage with the same people. You may go out 15 times, and the 16th time, you know, they have an infected sore on their leg, and you say, hey, I can take you to the clinic. And that might be, you know, the real opening of the door to say, I gotta get off the streets, I can't do this anymore. I'm tired, I'm sick, I'm not well. Waiting lists for permanent supportive housing, we have units that are turning over every day. We have units that are opening every day. And we have what we call a permanent supportive housing, or the PSH pipeline, which is one of those things that's being managed, where we're trying to create more and more permanent supportive housing units. For families now, I will say that's typically different. You know, families, more often it's because of a medical crisis, it's because of a loss of income. Maybe one of the adult partners left or lost a job or was incarcerated. You know, when you're living in poverty, and we are a high poverty, you know, urban community, when you're living in poverty, there's not a whole lot between you and the loss of income and homelessness, which again is why in our community we're prioritizing families with young children.
Yeah, I think we need to there, because we do need clarity here by 3 o'clock. But yeah, well, yeah.
Well, you know, we can. Well, while we're packing up, perhaps if you have any questions for Eva, you'll about 15 minutes that you can chat before we completely clear the room. But actually, if I could just give a quick, just kind of a closing thought, is just that you know, when it comes to atheists and, you know, people who don't believe in any gods, there's obviously a very prevalent misconception, the idea that, oh, we don't have morality, we have no moral compass, you know, we have no accountability to a higher being or whatever, you know, which obviously is untrue, but, you know, from my perspective, the way I've always seen it is, if anything, it's even more important for somebody who doesn't believe in God to want to do good for others and show compassion for the less fortunate. You know, Ariel on his business cards has, you know, we have to help each other, because if we don't, then nobody else will. I think I got that right. Anyway, and it's not only that. I mean, not only is it the fact that, you know, we can't just say, oh, well, they can pray for, you know, God to help them and He'll come and, you know, whatever. We also can't. When people are going through tragedy and, terrible life circumstances, it doesn't necessarily mean that, oh, it's part of either God's divine plan, he's testing them or whatnot. We can't say that. We can't say that, oh, it's karma, oh, they must have done something bad, so they're being punished karmically for it. It's really, hey, some people, they have horrible tragedies and go through terrible times, not necessarily through any fault of their own. So I think that just goes to show just how much more important it is that we do, show compassion for others, and why this is such an important issue. So yeah, I'm very, very happy that you were able to come and talk about this and, raise our awareness